Is there an age limit beyond which you cannot get pregnant using an egg donor? Well, biologically, technically, no. Your uterus doesn't technically age in terms of its ability to actually have an embryo implant and stay implanted. This means that even if you're in menopause and your ovaries are no longer functional, or if you've had your ovaries surgically removed, we can still get you pregnant. We can give you hormones to support that early pregnancy, and eventually the placenta will take over. Don't believe me? Check out these headlines. Just 2 years ago, it was reported that this Indian woman gave birth to her first child via IVF at 70 years old. And here's another report coming out of India of a 74-year-old woman who gave birth to IVF twins conceived using donor egg. So yes, it can be done, but the question is, should it? Both of these extreme cases happened in India, so there are certainly countries that have a lack of regulation, and then there are other countries that are more strict and impose very specific age cutoffs. This is an important issue to address here in the US. 824 women over the age of 50 gave birth between 2019 and 2021, so this is increasing in prevalence. And while there may not be a very specific age cutoff here in the US, we look to societies like the American Society for Reproductive Medicine, which put out this ethics statement, weighing the different ethical principles we should consider when patients who are older are looking to use donor egg or their previously frozen eggs or embryos to conceive at an older age. They say it's ethically permissible for programs to decline to provide treatment to women of advanced reproductive age based on concerns over the health and well-being of the patient themselves and their offspring. So what's the problem with this? Well, first and foremost, there's safety concerns. As we get older, our uterus may have the ability to still have an embryo implant, but the ability to carry that pregnancy safely can be challenged. As we get older, there are higher risks of problems like high blood pressure, diabetes of pregnancy, preterm delivery, just to name a few of the many complications that are more prevalent. And this can affect the health of the mom as well as her child. And then there's the ethical question or dilemma of who's going to be around to look after this child. What is their support system? If the age of the woman is in her 50s or older, what is the age of the partner? Some programs will look at the combined age and say that the combined age should be less than 100. But all of this has to be balanced with the ethical principle of autonomy, which is someone's freedom and right to make an informed decision about their own body and their life. In one of their earlier statements in 2013, ASRM actually said that it should be discouraged to use an egg donor or to carry a pregnancy over the age of 50 if there's any medical problems that could make it more risky, and it should be discouraged or not recommended at all over the age of 55. So yes, it is possible to get pregnant in your late 40s and your 50s and beyond. But before considering this step, it is important to be responsible and to undergo a rigorous medical screening focusing on cardiovascular health and other risk factors for obstetrical issues, and to do a psychosocial screening to make sure there's adequate supports in place to raise a child to adulthood.